Hello and welcome. I'm Sarah Beardon, and the research I'm presenting today focuses on health justice partnerships, which are service collaborations between healthcare and welfare rights advice services. These are cross-sector, interdisciplinary partnerships that utilise the power of the law to tackle socio-economic circumstances that are harmful to health and contribute to health inequalities. Social welfare law covers issues such as welfare benefits, debt, housing and employment, and provides protections and entitlements to ensure that people have a decent standard of living and access to essential services. So by providing legal services in a healthcare setting, this can reach people at a time of need, it can address underlying causes of poor health, it can improve mental well-being, and it can also provide support for healthcare professionals in their day-to-day work. Health justice partnerships exist across the country in diverse forms, but there hasn't been much research on their implementation that could inform policy and practice in this area. So this poster describes a comparative case study of service models across England, and this was undertaken to understand the different approaches in more depth and to explore factors which affected successful service delivery and also sustainability of the partnerships. This study uses qualitative methods and it draws on interviews with health and legal teams, as well as the service managers and funders. And the data collection and interpretation are informed by the general theory of implementation. There are four main aspects that I explored in the study, which are shown on the poster. The first was service models. So the poster shows the diverse characteristics of these partnerships, including where they were based, who was providing them, and some of their main design features. The second thing was collaborative working, so how the health and legal teams were working together on a day-to-day basis, and this varied from basic exchanges to closer ways of working that involved a greater level of communication and coordination between teams. The poster also presents factors which affected whether or not individuals would engage in cross-disciplinary working. Willingness had quite a strong influence, as well as team confidence, which was something that tended to develop over time, and also issues about practical ability, such as having the knowledge and awareness, and also opportunities to interact. The third issue I explored was sustainability, and the poster shows the trajectories of the partnerships over time, so how long they had existed and whether or not they'd been able to continue. And it also presents factors which had affected the decision-making of funders as to whether or not to continue supporting the partnerships, because funding was by far the most important factor in their survival. And again, willingness, which was hugely influential here, including people's opinions on the value of the partnership and whose responsibility it should be to support it. Data and evidence were also important, as well as strategic level relationships, and ultimately, of course, the level of funding resource available. And the last issue I investigated was impacts, and this was a qualitative assessment which was aiming to explore whether we might expect different outcomes from different models, and this was to inform service delivery and future evaluation studies. It shows that while certain outcomes were universal across the case study services, others were strengthened by a closer collaborative working approach. The poster finishes with some initial recommendations for encouraging team working and increasing the sustainability of partnerships. Many thanks for listening, and please feel free to contact me with comments and questions.